Hello, everyone. Dr. Mark Russo here, discussing medical issues that will arise while you're on dialysis. So your kidneys are not functioning anymore at 100%, and that's why you're on dialysis. But your kidneys do not only clean the blood of toxins, they're responsible for generating several hormones. And this is why we're going to be discussing some of the things when we round on you on a regular basis. So on a monthly basis, you're going to get what we call the report card. One of the first things that we're going to be looking at is your nutritional level and how much nutrition you're getting, and that is the albumin. So we aim for, or our goal of albumin is 4.0. If you're below that, we're going to tell you or ask you, you need to eat more protein. You need to eat more protein. You can do it in the form of egg whites, the lean meats, and fish. You'll discuss that directly with the dietitian. Another topic is anemia. Why do we worry about anemia? We're taking your blood out, cleaning it. You do lose some blood in the filter, so your hemoglobin will go down. In addition, it's been determined or found many, many years ago that your kidneys make a hormone that tells the bone marrow to make red blood cells. And that hormone is called erythropoietin. We'll give it to you, and it may be a different name. We'll give it to you while you're on the machine. We may give it to you once a week. We may give it to you once a month. It all depends on where your hemoglobin is. It also depends on how well your iron level is. You may have low iron stores, so we may be giving you iron on a regular basis. You'll try to take iron pills, and you will find out very, very quickly that it's almost impossible to get your iron level up on those pills. What typically happens is when people get closer and closer to needing dialysis, they lose the ability to absorb iron. That's why we have to give it to you intravenous. Phosphorus, you're going to hear this constantly over and over and over again. Your phosphorus is too high. You need to take this binder. Take that binder with the very first bite of the meal. I tell people, take the bite of the meal, then take the pill on the second swallow. This way you're getting it, and the pill is sitting in your abdomen, it's in your stomach, and it's looking to bind the phosphorus and keep that lower. Since your kidneys aren't working, it has a very difficult time. Your kidneys cannot get rid of that phosphorus in a timely fashion, so we have to get rid of it through your stool. Why do we worry so much about high phosphorus? Phosphorus binds with calcium. And if your kidneys were working, what happens when calcium meets phosphorus in your kidney? You make a kidney stone, or the beginnings, it could be at the very beginnings of a kidney stone. The exact same thing is going on in your bloodstream. Well, there's no stone to evacuate from your bloodstream. What happens? It adds to worsening hardening of the arteries. That's why we want your phosphorus down. It's not going to kill you in the short term, but it will hurt you and potentially cause problems in the future. It may cause something called calciphylaxis, which is a very, very difficult to control or heal wound. Blood pressure medications. The goal will be trying to get you off blood pressure medications. And by doing that, or how we do that, is by pushing down your dry weight. Your dry weight is the weight that you walk around with on a daily basis. Since your kidneys aren't working, you hold on to fluid for those 48 hours, those 24 to 48 hours before you start your next dialysis treatment. And that's why especially over the 2-day rest on the weekends, whether your days off are Sunday, Monday, or Saturday, Sunday, that's when you have to be specifically more careful about taking in fluid. We ask that you don't drink more than a quart to a quart and a half of fluid per day. Remember, there's also fluid in your foods, so be very, very careful. Weigh yourself every day, take your blood pressure. Note that you're going to hold those blood pressure medications on the days of dialysis, but bring them with you, because maybe if your blood pressure is elevated, we may ask you to take one of those medications. We do have emergency medications here, such as clonidine, that we can administer to you if you need it for an urgent situation. Your urine output is going to decline over the course of time. Eventually, some of you that have started dialysis, you're still urinating, but please recall some of the things that we've told you in the office. Your kidneys lose the ability to make urine, but they don't lose the ability to get rid of the water right away. So some of you that are still going to the bathroom, and you'll tell us, Doc, I'm still going to the bathroom. Yes, I understand that. You're just putting out water from the kidneys. You're not putting out adequate urine. Eventually, that ability to get rid of water goes away, so you depend more and more on the machine to remove that fluid and to remove those toxins. That's why many times we'll have to increase the treatment time or go to a larger filter, change the blood flow rates around, or change the dialysate flow rates around. but it's unusual for us to reduce your treatment time. We usually always go up on the treatment time, where everyone eventually approaches 4 hours of treatment 3 days a week. Please recall that you can consider doing home dialysis, this very therapy that you're performing now. You can do home hemodialysis, or you can convert to home peritoneal dialysis, so you don't have to come to the center, so you're doing it at home with the assistance and benefit of your family members seeing you around more frequently. If there are any questions that you can ask us when we see you at the dialysis facility, either myself, any one of my associates. For now, Dr. Mark Russo from Naples Nephrology saying so long. We'll see you at dialysis, and live a continuous healthy life.